Hello and welcome to another exciting episode of the Career Conversations podcast here at the University of California, Merced. My name is Rob Goodman. I'm the Natural Sciences Career Specialist here at UC Merced. It's my role here to make you as competitive as humanly possible for your next steps, whether your next steps are grad school, med school, whether it's going off to a career internship, or if you're interested in innovation and entrepreneurship. I'd love to talk with you and help guide you to your next steps. Today, I'm here with a special organization that's really going to talk to you about a lot of cool aspects, particularly around healthcare needs, particularly around medical needs, particularly around public health and community impact. I'm here with Central Valley Health Network today. Can you please introduce yourselves?
Hi, I'm Halima. Nice to meet you.
I'm Meg, or Megumi.
Hi, I'm Christian Vargas, and I'd just like to say first and foremost, thank you, Robert, for inviting the CVHN team to participate in this Career Conversations podcast series. We really appreciate it.
And we really appreciate you and your voice and the stories that you're about to tell our students who are honestly going to be interested in a lot of the opportunities that CVHN has. So the first question that I have for you is the question. It's the question that in an interview setting, you will not, in terms of being asked 95% of the time, you will receive this question. The question is, so tell me a little bit about yourself.
Yes, well, as I mentioned, my name is Christian Vargas. Within Central Valley Health Network, I'm the Quality Improvement Program Coordinator. I've been in this position for well over a year and a half now. And, more than anything, I want to share with all of you that I am also a fellow UC Merced alumni and a Bobcat. While I was a student here at UC Merced, I majored in public health and I minored in psychology. And during my time here at UC Merced, I was able to really grow my passion and my motivation to, continue my career beyond my undergraduate education in public health and really work to serve the greatest needs here in the Central Valley. Aside from that, I had some really great experiences that I'll talk a lot more about later on. But, of course, here at UC Merced, I was exposed to so many research opportunities through the Undergraduate Research Opportunity Center. I also had the opportunity to participate in the LEAD Pre-Health program. And that's a little bit about my educational background. But really, my other personal interests include, public health advocacy, entrepreneurship, community engagement, among other, personal interests. I'll pass it on to my peers to share a little bit more about themselves as well.
Okay, sounds good. So yeah, I'm Meg or Megumi, and I graduated from UC Merced back in May of last year. And I'm proud to say I'm an alumni, and currently I'm serving with National Health Corps and Central Valley Health Network at Livingston Community Health. And that's a FQHC, a federally qualified health center. And we serve underserved communities. And within the 10 clinics throughout the Central Valley, we're able to connect with those who are underserved, uninsured, and don't have transportation. So we're trying to limit those stigmas and help the patients as much as we can. And I'm hoping to further my career in healthcare. So this is a great opportunity. I was also in the LEAD Pre-Health program here with Robert, and that was a great opportunity to really solidify my goals into becoming a healthcare professional.
Cool. And for me, I graduated from Cal State Bakersfield, and I joined the program to also gain more experience. Well, not just clinically, but also like a community service opportunity. And through my research from medical schools, they recommended the AmeriCorps program, which was how I came to find this program. And I think it's been really eye-opening so far, especially into the field of the healthcare.
Awesome. Thank you so much for sharing a little bit about yourself. Students, that is how you do it. That's a slam dunk answer. Are there any ongoing changes and trends within your sector that you're excited about in the future? particularly within the healthcare advocacy and community engagement sector?
Yes, that's a great question. And I would say, you know, I would like to acknowledge that, there, because of the COVID-19 pandemic, the healthcare sector was definitely impacted in, many distinctive facets. But I would say that, in this last year, in 2023, we've began to see positive trends in terms of the healthcare workforce and, more than anything, opportunities and programs such as the National Health Corps program or AmeriCorps programs are perfect opportunities for our fellow students who are aspiring to become public health leaders and ultimately make that transition from their undergraduate journey to the workforce. And so we've began to see some positive trends, and our hope is that here in the Central Valley, we could continue to build on those positive trends and really support, the different healthcare sectors, both the public health systems, the hospitals, very much, our fellow federally qualified health centers. These are all important healthcare sectors that were impacted because of the COVID-19 pandemic. And so, as I said, we've begun to see some positive trends, I would say.
And to build on that, I would say like some ongoing changes would be maybe like an increase in more not lower level, more entry level healthcare positions who are more involved in the community. Example like community health workers, because we know with physicians there's really a shortage of physicians in Central Valley, and having to have like more access or more getting more people out there to go into the community to help people, their fellow like community members, try to improve their health by promoting more preventative measures. I think that's a really good thing because physicians, mid-level practitioners also need that extra support to improve the field of healthcare.
Excellent. And I want to be mindful also about your organization as well. Could someone could someone tell the program what exactly Central Valley Health Network does right now? I think that might give our students a little bit more perspective of the organization as well.
Yes, that's a really insightful question. Thank you, Robert. So, Central Valley Health Network, we have three primary pillars or buckets of work that we essentially focus on. So at the macro level, we focus a lot of our advocacy and supportive work in terms of both policy and legislative advocacy. We also focus on quality improvement, and more importantly, I would say one of our major focuses is workforce development. As we just mentioned, within the workforce development sector of Central Valley Health Network, we have all of these amazing opportunities with both, the National Health Corps program, AmeriCorps program as well. And so to provide all of you with more insight onto, the opportunities within the National Health Corps program, for instance. So to say the Central California area and the communities around us have been essentially designated as health professional shortage areas by the federal government. And, of course, our health centers have struggled to continue to find health professionals at levels that are both linguistically and culturally competitive of the patients that we serve. Through the National Health Corps Central California program, our members are going to address this workforce shortage and the public health disparities encountered through the area by serving the growing needs of our diverse communities with host sites in Sacramento, the state capital, and throughout Central California. From Sutter County to Kern County, our members will serve that at their time at a participating federally qualified health center where they will address the needs of the communities by providing, for instance, outreach, education, while also gaining a meaningful experience for their future aspirations. And, if you both have anything else to add, that would be great.
Yeah, Most of the members with NHC, we all serve at federally qualified health centers, and we provide direct and indirect patient care. So that's been very rewarding for both patients and myself.
Yeah, and it's also, I would say, a good way to um, go out there and see what the community really needs, and also try to implement those changes into the healthcare system, and properly serve the community in general.
Awesome. Thank you so much. I think that gives our students a little bit more knowledge about CVHN, of the important work that you do in the Valley. I always talk about that the Valley is full of invisible communities. Like we see a lot of communities right off of on 99, on 5, Madera, Atwater, Merced, Fresno, Bakersfield. We see those communities, but there's a lot of communities that are scattered, that are 300-person towns that truly are. A lot of people don't know they exist out there, and so. And I think CVHN really serves on the front lines of providing healthcare service and access points and equity points to those invisible communities that may be out there. And there's quite a few of them. So thank you for that service to our region. On the idea of trends in this field, how can our current undergraduate students really that really want a career in this space, maybe healthcare advocacy, maybe they're pre-med, maybe they're pre-health, maybe they're public health. How can our students that want to seek a career in this space, how can they better prepare for these trends in the future?
I feel like a way to better prepare for the trends would be to not just limit yourself to, like, doctor or nursing. Like, I would say to be open to the um, other fields in medicine, because there's like a broad number of positions you could work as and still be able to serve the community in a healthcare kind of setting that you're wanting to, like a physician assistant, for example, a nursing practitioner, a respiratory therapist, because especially in the Central Valley where the air quality is so bad, and we have like people with asthma and like other COPD diagnosis, so I'll just say, like, to be open to exploring the options and seeing what is out there.
Yes, and additionally, I would say, for our fellow students who are, seeing us, I would, more than anything, I would say that during your time here at UC Merced, really focus on building some of those relationships with, potential mentors, explore, professional development opportunities such as, as I had previously mentioned, the Lead Pre-Health program, which was really amazing. It was an amazing opportunity to learn from, to, develop our own professional skills. And not only that, there's other environments here at UC Merced, such as the Undergraduate Research Opportunity Center. There you could, participate and conduct research over the summer. And, there's also other opportunities to present some of that research at your, potential conferences. You have the opportunity to network, to, learn about all these different topics that might help you obtain a better understanding of what you ultimately want to pursue after you finish your 4 years of undergraduate education. I would also say that, our clubs and organizations here at UC Merced are an amazing avenue to start building some of those skills and, just connections in general. There's a lot of great clubs here at UC Merced, such as Global Medical Training. I know that there's also our public health club that we have here on campus. So those are some examples as to where our students could look for those opportunities. I would, I also highly recommend, for fellow students to come here to the Career Center and to, have these discussions with Robert or Leslie and see, what opportunities or what internship opportunities are out there for all of you to explore.
There's definitely a lot of opportunities in the Central Valley just to get connected, see what the population is like. I know my time in UC Merced, I was kind of sheltered because I didn't have a car, so I was just in UC Merced. But with this opportunity, I was able to go to the hidden cities like Hillmore and Waterford, and realize that those populations are where most people need help. And just knowing that the Central Valley, there's a lot of um, undocumented or uninsured farm workers, and those are the people that need the most help.
And to add to that, I would say like better prepare by starting early too. So you want to start from early on so you can build on those experiences.
I think that's a great point there, Halima. And, also to chime in a little bit more, I know that as I mentioned, those internship opportunities do really make a difference. And so, for example, one of these internship opportunities comes through the Health Career Connection, HCC, which, HCC does provide internship opportunities out here in Central California. And the best thing about participating in this opportunity is that you are able to be placed in, external agencies or, public health, community-based, organizations that really advocate and support our patient populations out here in Central California. Yes, but of course, our National Health Corps program, AmeriCorps program, those are all opportunities that we're actively recruiting for and looking for, potential candidates that would be willing to join these efforts.
Yeah, and I think that program that you just mentioned as well. If you are a pre-med, pre-health student, you're taking a gap year, National Health Corps is fantastic. It allow you to go out and really get those clinical hours in, get those service hours in, get leadership in public health. I think that's a different program. But it's a fantastic sort of opportunity. I'm not sure. Could you tell us a little bit more about that program, National Health Corps?
So the program is basically like a um, it's a federal government program where the members are placed in different federally qualified health centers across the Central Valley, and even in other states too, like Philadelphia. We also have like another group in San Francisco. It's all over United States, and a lot of the members are put in those FQHCs to serve the underserved populations, and you have different tasks actually because your position varies depending on what clinic you're working at. Like for example, I'm a capacity builder, and I'm doing more of recruiting more AmeriCorps member to be a part of the NHC program, and I'm also like a community health outreach. So I do also like attend health conferences and get to meet people and see like what ways we can better improve the field of healthcare basically.
Yeah, within this program, there are opportunities for future healthcare professionals or public health professionals to just have a jump start, build connections, just have those experiences such as clinical hours, shadowing hours, and positions are flexible. And just let your supervisor know, and they'll try to adjust the member description to fit your wants in that program.
Yeah, and to add to that, I would say it's a really cool program because you do get exposed to like some aspects of healthcare that you never really paid attention to. For example, the uninsured and like the uninsured Meg and Christian mentioned, because we attended a conference like a few weeks ago, and it was really an eye-opening experience to get to discuss around the table with people and see what are the changes we could make to make the healthcare more accessible to such populations or such areas.
Thank you, Halima and Magumi, and to also provide all of you with more information about these opportunities. So, the National Health Corps program does provide paid experience. We also provide an educational award. As both Halima and Magumi mentioned, we do offer cohort experience and training opportunities. We work with our federally qualified health centers to, place our fellows in those specific areas where our fellow health centers, have that greatest need. And so we do work with both, the candidates and the FQHCs to ensure that, our fellows are placed within those positions that they would ideally like to serve in. Additionally, two other opportunities that I would like to highlight really quickly is that CVHN, we do have the Community Health Fellowship Program, CHF, which, it's an opportunity that's currently available at the moment. And CHF is placing candidates in both Hanford or Lemoore and then the Marysville areas. Members that are placed here must be familiar with, needs of the patient population, but at the same time, there's opportunities to learn about the patient population. And, this program does provide community health worker certification, digital navigation certification, and other medical interpreter certifications if applicable to the, applicant or fellow. Aside from CHF, we also have the Public Health Leadership Program, which hosts its members in various locations across the Central Valley. So ranging all the way from Yuba City down to Lemoore, California. This program, I would say, it's a great opportunity for those individuals who are pre-med, individuals who are really invested in both public and mental health focused initiatives, or are, of course, also pre-health law, which is another really important sector. I would also say that this position varies from quality improvement to outreach to compliance, a lot of variety in those opportunities that we could offer to those interested candidates. And so I would say, please take the opportunity to look more into CVHN. If you're, by all means, if you're interested in any of these opportunities that we just covered, we could, provide our own contact information to, start some of those conversations and see how we could support your own endeavors and aspirations.
And to add to that, we also have an AHEC Scholar program,
Right.
which is for high school students and also medical school students, and you get to basically learn more about like the social determinants of health or all other how to better serve patients. It's a focus on patient care focused in a sense, because you're trying to using that program, we're trying to teach the students that the patients are really like the ones in control of their health, and they have rights to be able to communicate that with their provider, which then helps improve the quality of healthcare treatment that they're getting. And so the program, I think, lasts for 6 months, I think, for high school students, and they do get a stipend afterwards, and same for medical students too.
Awesome. Thank you so much. We are coming to the time of everyone's favorite question. If you are a longtime listener of this podcast series, you know that I absolutely hate bubblegum ice cream. I think it's vile. I think it's the worst tasting thing in the world. There's nothing worse than bubblegum flavor ice cream. Why? Why was it created? I just don't get it. Hans, who's here in the room with us, by the way, right here, we have debated multiple times. Regarding bubblegum ice cream, and I think it's the worst. So we've spoken quite a bit about that. However, my question for you today is, what is your favorite ice cream flavor, and why is it not bubblegum?
Okay, I guess I'll go first. My favorite ice cream flavor is vanilla, and it's not bubblegum because, I don't know, it just tastes weird.
My favorite ice cream flavor is cotton candy, and although it resembles bubblegum has little pieces of gum that when it like turns cold, it becomes like a mushy consistency, and that's not for me.
I would say mine is definitely Rocky Road or vanilla, but very funny enough, growing up, I remember that, I would often have those, ice cream bars that would also have bubble gum in them. So, even though it's definitely not one of my favorites, it does bring a lot of memories, from the past as well. Yeah.
When you ate the Teenage Mutant Ninja Turtle ice cream bar, that's probably what it was.
Yeah.
Or the SpongeBob one.
Or the
too.
SpongeBob one. Like the bubble gum was separate from the ice cream itself. And I'm just talking like you go to the store and it's the pink ice cream that's just flavored like bubble gum. Just don't get it. I mean, why not just chew bubble gum if you want that?
Yeah.
Hans, what's your thoughts?
I don't think it's that big of a deal, honestly.
I think it's a huge deal. It's a huge deal. So that next question that I have for you, back to the business of possibly our students engaging or future students engaging with CVHN. Why is now the time to work in this sector?
I would say like the field of healthcare is always, I don't know, it's always booming, I guess. No one ever stops going to the hospital or to the clinic. We're all sick or something. There's always something going on. So it is a good field to work in because humans are always going to need some sort of healthcare eventually.
I feel like now is the time to work in this sector because with the new Medi-Cal bills that has been passed this year, now immigration status they're not considering that into care. Anyone can receive care, and so there is more patients, there is more professionals needed to give care to these patients, and it's now or never.
I'd also like to echo both Halima's and Megumi's comments. I think that, now more than ever, this is a time to work in the public health sector because here in the Central California region, we have some of the most growing needs when it comes to serving our patient populations. I would also say that within the public health sector, it's not only about medicine, but there's a variety of other opportunities that are involved with public health. So for instance, if you're passionate about technology or IT, or if you're passionate about public speaking, there's always going to be opportunities in public health where you could continue to develop those passions, but at the same time be a public health leader and really support the communities around you, especially here in the Central Valley the Central Valley region, where we have a lot of cities and towns where our patients are not properly served. And so how can the next generation of healthcare leaders really change that? How can we go out into the community and really advocate for those patients and ensure that there's that proper access to care, not only access to care, but quality of care that our patients are receiving? So I would say definitely the public health sector is an area to really invest more time into if you are passionate about, serving the greatest needs of our respective community.
Well, thank you. One of my final before we get to one of my final questions. As you mentioned, two of you are actually alumni from UC Merced, and I wanted to sort of get your perspective on the campus and sort of ask you, what do you miss most about UC Merced?
What I miss most about UC Merced is that since it's such a smaller school, I was able to connect with a lot of people. Even professors were open to questions. Office hours, I was there, and just making friendships and connections was very easy for me just because everyone knew each other, and that is one of the motivators that led me to pursue a career in healthcare.
I would say on my end, what I miss most about UC Merced is, of course, being able to participate, having that opportunity to make a difference within the UC Merced community and, the greater Merced community as well. I would say that I often think about, a lot of the buildings here on campus, the Dan Cathedral, where I dormed for some time. The Coling Library, a lot of memories here at the Lantern Cafe. I would say that it brings a lot of memories, and I really do miss that. But at the same time, I'm very excited and grateful to say that UC Merced continues to grow in so many ways. When I started here as a freshman, back in 2018, UC Merced was a lot smaller than what it is right now. As you can see, we went through the pandemic. We had the 2020 expansion project where a lot of these new buildings came up, and now most recently we have the UC Merced Medical Education Building coming into fruition, and that's something that I originally learned about back in 2018, and to be able to still be here in the Central Valley and see that it's finally coming into place and that it's going to serve the greatest needs of our Central Valley region, and of course also support our students, staff, professors, and all of these individuals that are really passionate about medicine and education. I think that this is something that it's going to be innovative in so many ways, and so yes.
Awesome. Thank you so much for your perspective of the campus. I remember you both being in here, being part of Lead Pre Health as well, which is a great program for the students, particularly if you're pre med or pre health. And so I appreciate you sharing your perspectives. Listening to you speak, I know that a lot of our students will probably want to apply to several of those programs that you mentioned throughout this podcast. And students, if you need a reminder, just rewind and go through it and listen to it again, because there are a lot of programs through Central Valley Health Network, which I think you would be very interested in participating in. So I'm hopeful that you check out some of those programs. But if a student was interested in any of those programs that you mentioned today, what should a student do to start the application process? Where should they go? What could help make them competitive? What should they do next?
I would say we typically hire for students who have open availability, so it is perfect for your gap year experience. So all you have to do is just come prepared to learn and be ready for anything basically, and because you don't really need experience for for any of the positions. All you need to is just be a self-starter also, and just be willing to put yourself out there and make connections, and the willingness to grow and learn new stuff. And so you just need to go on the website mynationalhealthcorps.org, and that's like the central application website, and you apply for whatever position that you're trying to get into, and from there on you get like your interview emails and everything starts to fall into place. But yes, that's how to go about it, and be sure to, I guess, have your letters of rec or some people who can be like recommendations for you for the applications.
And of course, we'll ensure to provide all of this information to Robert. That way he could, you could also include it on the podcast video, and that way our fellow students could, follow and apply if they're interested.
Yeah.
Yes.
Sounds good. Hans, will you do that?
Yes, I will definitely get that prepped.
All right, sounds good. So Hans will do that after.
Thank you, Hans.
After our 4 hours of debate, our typical weekly debate on bubblegum ice cream. Awesome. So I know that that's going to be great resources for our students. And I know you'll get a lot of applicants and a lot of interest from our student population. I love your programs. They sound so much like a Bobcat program for me. Yeah. I just look at them like that sounds like UC Merced Bobcats all over the place for those programs. So really appreciate your time today. I want to thank you for coming by the program. Any last words of advice for our students?
I would say more than anything, continue to, build on all of the amazing experiences that you've had here at UC Merced. I think that the UC Merced community will continue to support you even after you leave UC Merced formally. I think that, this campus and just the community around us really, made an impactful experience, within my educational career and, my personal life as well. And so, stay positive, look after your self-care, but at the same time, really strive to, take those opportunities and make the best out of it. And I would also say, fiat lux. Yes.
And to build on that, I would say don't limit yourself and try to get as much insight into every field you can if possible. Just because, wealth, knowledge is wealth. So there you go.
Well said.
I would say start early, build connections. If the program descriptions look difficult, just don't be scared to apply because you never know where life will take you.
Yeah.
No, that's really true. And I would say, if you're interested in an opportunity that's out there, even if you feel that you don't have that experience, even if you feel that you don't have that shot to, make it happen, still apply, still put yourself out there, include your resume or include some of that initial experience that you've had, and, take those opportunities to really see if you could participate or be involved in, internship opportunities or research or any other opportunity that, calls out to you. So, yes.
And don't be scared to ask for help.
Yes.
Well, great advice, and thank you again for your stories, for your wisdom, for your ideas to the student. Students really appreciate your time. So students, your next steps, if you're interested, please do apply. But also, you'll see an end cap soon that's going to display other career conversations that we have done previously. If you're interested, please review and also subscribe so that the next time that we have another career conversation, you'll be notified that we have loaded something up. Appreciate your time, everyone. Thank you so much. And on behalf of UC Merced, goodbye, everyone.